I'm Rick Harp. This is your APTN News Brief for Tuesday, February 27th. We begin on the southwestern shores of James Bay and Hudson Bay, where a group of Northern Ontario First Nations is one step closer to establishing a massive marine conservation area. Now the Mushkegowuk Council has announced the completion of its feasibility study. Fraser Needham was there.
The study looked at an enormous area, 86,000 square kilometers to be exact, or slightly larger than the province of New Brunswick. The area, which runs from the southwestern tip of James Bay and then north and west into Hudson's Bay, is home to polar bears, beluga whales, and migratory birds. And this is why people like Amos Wesley want to protect the area's environment for generations to come.
And it's up to us to fight to keep it green, to keep it pristine, to keep it breathing.
Natasha Martin is the other Deputy Grand Chief of the Mushkegowuk Council. She adds this is why it is so important area First Nations push forward in creating a national marine conservation area.
I use the land. My dad uses the land. My uncles use the land. So I would never put in jeopardy anything that would affect that. And the reason why I'm talking like this is because I want you to understand how passionate I am for the land and how important this project really is.
Sam Hunter is an environmentalist from the Winnisk First Nation. He says climate change is yet another reason why the area must be preserved.
The most important thing is reducing your carbon footprint.
Mushkegowuk Council is made up of 8 different First Nations, and while there is largely consensus on conserving the area, how to get there is a different story. Madeline Scott, a band councillor with Fort Albany First Nation, agrees First Nations need to think long and hard before signing any agreement with the federal government.
I urge all young people to be careful of what you agree to. I urge the leaders, be careful what you're going to agree to, because it's going to hurt our children, our great-grandchildren.
Lawrence Martin, a former Grand Chief with Mushkegowuk Council, says he understands the concerns, but believes with time the First Nations will be able to move to an agreement with government everybody can live with.
It seems to be a lot easier to get consensus from the community members. They all agree that we need to protect the land and the resources. They want to protect everything that we talked about here today. But it's the chief and councils that are afraid to make that commitment, to sign any document. You know, I think it just requires more time, as what was stated here.
The feasibility study is just a first step in the process. Further negotiations and consultations with the federal, Ontario, and Nunavut governments will be required. Fraser Needham, APTN National News, Ottawa.
To British Columbia, where the number of people losing their lives due to toxic drugs continues to spiral. Tina House now on what some have done to try and make that drug supply safer and less deadly.
Safe supply! One more time, safe supply!
As the death toll rises across Canada, here in British Columbia, toxic drugs are now the leading cause of death for people under 59 years of age, accounting for more deaths than suicides, homicides, accidents, and natural diseases combined. Here at the Vancouver area network of drug users known as VANDU, pictures represent some of those that have lost their lives to toxic drugs. It also shows that accidental overdoses can literally happen to anyone from any walk of life, and BC is now seeing 7 deadly overdoses a day.
In this picture, everybody has passed away related to an overdose. It's quite sad and shocking, but it's more common than you think to look at a picture and see a whole group of people no longer here.
Brittany Graham is the executive director of VANDU. She says she knows close to 60 people personally that have died from toxic drugs.
Problem is that when people hear 7 people a day, like those are real people. Like they're, someone's grandparent or kid or anything in between. And so I think we're kind of so far into this crisis that it's like almost 8 years that people are sort of just used to it, and we shouldn't be used to it. It's a bigger issue than people are willing to admit.
It's been just over a year since BC launched a program to allow 2.5 grams of street drugs per person for personal use. The program is supposed to save lives, But has it helped at all?
We're not yet at a place where I can say this is one model, but it's not an either or. We've heard from many people that we need to have many different options for different groups of people.
BC Provincial Health Officer Bonnie Henry wants to prescribe other out-of-the-box safer supply solutions.
It's providing regulated or pharmaceutical alternative medications, but not necessarily through an individual prescription. I think there are models out there that we need to look at. I think we need to keep this conversation going. My office is doing a special PHO report, and we're in the process of looking at what's out there in other jurisdictions around the world.
Clinical studies have shown that Indigenous people are dying at a higher rate, and government officials are hoping that the prescribed safer supply program will be one of the many tools to prevent more deaths.
Prescribed safer supply policy should really aim to reduce inequities and decrease stigma and be provided in a culturally safe, trauma-informed way. We need to work with people who are disproportionately impacted, including Indigenous communities and populations, youth, others, to ensure we're meeting their needs and meeting them where they're at.
However, despite these measures to try and help, Brittany Grant points to a major hole in the safe measures currently in place.
Here in Vancouver, a lot of people who are Indigenous actually smoke their drugs as opposed to inject their drugs. Most overdose prevention services do not cater to smoking.
Tina House, APTN National News, Vancouver.
Two-Spirit people in Winnipeg and beyond continue to mourn the recent loss of Anishinaabe elder Kelly Houle. Born in Winnipeg, the 56-year-old activist grew up on Sandy Bay First Nation prior to their removal into Sandy Bay Residential School. A well-known and respected advocate for Two-Spirit people, harm reduction, and for missing and murdered relatives, Houle was crowned the 18th International Two-Spirit Princess. The Jingle Dress dancer helped organize the first ever Two-Spirit powwow at a Pride event in Canada and was Pride Winnipeg's Grand Marshal in 2017. Her cause of death remains unknown. Houle had battled illness and was in hospital for a number of weeks leading up to her recent passing. To Whitehorse, where some downtown business owners and residents claimed the behavior of some emergency shelter users has them feeling unsafe. Concerns the territorial government says it's responded to under its Safety Response Action Plan. Those actions include the relocation of food services away from the shelter, extending the contract for a private security firm to patrol the downtown core, the launch of Moccasin Mobile, an Indigenous outreach service, and this spring's opening of a managed alcohol program. Minister of Health and Social Services, Tracy Ann McPhee.
We will continue to listen. We will make sure that we are listening to members of our community, business, citizens, people with learned experience, individuals who are street involved, and doing absolutely everything we can to respond to that in a real way.
And finally, a hands-on housing program for communities interested in energy-efficient retrofits recently wrapped up. With more on what participants got out of the 2-week program, Annette Francis.
These hands-on experiences in retrofitting old homes will come in handy for Mercedes Sandy. She's the housing assistant in her community of Beausoleil First Nation in Ontario. She has a passion for safe, affordable housing, so when she heard about the Project Accelerator program, she jumped on board.
Hopefully I want to do like a net zero apartment building to help address some of our housing crisis in my nation.
Indigenous Clean Energy is the organization behind the 18-month program. Its goal is to help participants create an energy-efficient work plan for their communities. At the end of it all, there's $125,000 available in project grants to assist each participant. And according to the project manager, Cody Cote, there will be ongoing supports available during the project stage.
Majority of the projects are retrofits. They want to address the current housing stock first. That's where we're seeing a lot of the challenges. But the good thing is that knowledge is transferable. So all of the building science stays the same. You can kind of take that and apply it to new builds.
There's lots of health issues because of poor housing.
Corey Caulfield is the Community Energy Coordinator in Pikwakanagan First Nation in Ontario. He says the skills learned here will help him to engage more with members to help address the issues in his community.
Everyone's paying high utility bills, or higher than they should be, because subpar construction. My goal is to address all those and to make the standard of living in Pikwakanagan much better.
For Sandy, connecting with other Indigenous participants across the country has been empowering.
We all come from those same situations. We have those same problems in our communities, and we're sharing knowledge of what they're doing in their communities, and we can bring it back to our nations and say, hey, we can do that.
Although the 2-week hands-on program is complete, the program isn't. Cote says each participant will have access to a one-on-one mentorship and technical support to achieve their goals. Annette Francis, APTN National News, Wakefield, Quebec.
And that's your APTN News Brief for Tuesday, February 27th. I'm Rick Harp.